The report highlights the urgent need for strategic investments in mental health services. It calls for sustainable funding, improved training for health professionals, and nationwide awareness campaigns to reduce stigma and promote understanding. Program Manager for Mental Health, Jawara, presented findings showing that mental health affects more than 12% of the Gambian population.
Mental health affects over 12% of our population and accounts for over 6% of our overall disease burden as a country. Yet, for decades, mental health has been sidelined, overlooked, and underfunded. This report changes that. This report indicates our actions, the cost of our inactions, but also demonstrates the benefits of investing and the return on investment.
Minister of Health, Honorable Dr. Ahmed Lamin Samate, describes the report as a milestone in the country's health reform efforts.
It is with great honor and deep conviction that I address you today at the launch of the Gambia's Mental Health Investment Case Report 2025. This is not just a milestone, it is a turning point in our collective journey towards a healthier, more inclusive, and more compassionate Gambia. The government of the Gambia recognizes mental health as a public health priority. This commitment is reflected in the National Mental Health Policy 2025 to 2035, as well as the finalization of the draft Mental Health Bill, which aligns fully with our national development goals and the health sector strategic plan. Mental health is now rightly considered a critical component of overall health and well-being.
Keynote speakers from the World Health Organization, the United Nations Resident Coordinator's Office, and the National Assembly's Health Select Committee Chairman emphasized that investing in mental health is essential to building a resilient and inclusive society. They urge stakeholders to use the report as a roadmap for closing gaps in care and improving access to services. Vice President of the Gambia, Mohamed B.S. Jallo, noted that mental health is not only a medical issue, but a burden development concern.
Mental health is not only a medical concern. It is a national development priority, a human rights issue, and a moral duty. Consequently, poor health leads to lost income, broken families, and lower productivity. It affects education, employment, and national cohesion. When a young person's potential is lost to untreated depression or substance misuse, the nation loses part of its future. When trauma goes unaddressed, it can echo across generations. This is why mental health must be embedded in all sectors, from education to justice, agriculture to...
The launch of the Gambia Mental Health Investment Case Report marks a critical step towards recognizing mental health as a core component of national well-being. It signals the government's commitment to empowering citizens and creating a supportive environment for those affected by mental health challenges. Reporting for Star TV News, I am Baikor.